Welcome, and thank you for joining us today to urge support of AB 2317, which will help us close a gap in essential child care services for our youth, Children's Crisis Residential Services. AB 2317 would create a licensing path to create children's crisis residential programs and ensure much needed funding for these programs. This level of care for children in a behavioral health crisis does not exist in the state of California, despite the well-documented need. Before the pandemic struck, California incidents of youth deliberately causing self-harm increased by 50%, and in the state between 2009 and 2018, according to the state auditor's report. The U.S. Surgeon General recently warned of the growing mental health crisis among our youth that was exacerbated by the pandemic. That is why it is critical that we do more to provide services that are accessible, affordable, and can provide the stabilizing, longer-term care required to treat substance use disorders and serious mental health issues. By adding the Psychiatric Residential Treatment Program as a licensing option for children's crisis residential programs and establishing an appropriate licensing category, the state and counties would have access to this essential component to mental health crisis services under Medi-Cal early and periodic screening, diagnosis, and treatment of federal entitlement. I would like to thank many of the providers who are here this morning to support AB 2317. We have with us David Baker, Chief Executive Officer from Sacramento's Children's Home, Glenis Butler Stone, Chief Executive Officer of the Children's Receiving Home of Sacramento, and Marika Collins, Public Policy Officer for D.D. Hirsch Mental Health Services, and Asiam McGuire, Executive Director, Progress Ranch Treatment Service. In addition to the groups I just mentioned who are supporting AB 2317, we also have support from the Steinberg Institute, SEIU California, the National Alliance on Mental Health Services, Family Care Network, Inc., Greater Hope Foundation for Children, Healthier Kids Foundation, National Association of Social Workers, California chapter, and many more, because of the need for getting services to our youth in the state of California that is so drastically needed. Finally, I want to thank the administration, and in particular Secretary Ghali and the administration, for working closely with my staff and our stakeholders to make sure that we can close this gap in this much needed service for AB 2317. I want to thank all of you for your hard work on behalf of the children of the state of California. Now, at this time, I'd like to welcome up Christine Stoner-Meritz, CEO from the California Alliance of Children and Family Services and the bill's sponsor.
Thank you so much, Assembly Member. I'm Christine Stoner-Meritz with the California Alliance of Child and Family Services. We represent 160 nationally accredited nonprofit community-based organizations that serve children, youth, and families in public human service systems. Our members deliver care to some of the most vulnerable children and families in the state's Medi-Cal system. And they are seeing higher acuity and more intense behavioral health needs across the state than ever before. We are the proud sponsor of 2317. AB 2317 addresses a significant gap in the behavioral health continuum for youth. Because California lacks programs that specifically meet the intensive needs of youth in behavioral health crisis, those children languish in emergency rooms and simply go unserved when it matters most. The necessary treatment programs do not exist simply because California does not have a licensing category for these programs that exist in many other states. AB 2317 addresses this gap by adding a new licensing category in state statute, the Psychiatric Residential Treatment Facility. These programs are short-term, deliver intensive care, and have a goal of stabilizing youth quickly so they can step down to less intensive treatment services. We sincerely appreciate the partnership we've had on this bill with Assemblymember Ramos, the Newsom administration, including Health and Human Services Agency, Department of Healthcare Services, and the Department of Social Services. We also appreciate all of the partners we've been working with on this bill, many of whom are speaking today or are in the audience. Thank you very much. I'll turn it back to Assemblymember Ramos.
Thank you so much. Thank you. And next, I'm pleased to have Alex Briscoe, Principal of the California Children's Trust.
Thank you, Assemblymember Ramos. It's my pleasure here to speak in support of AB 2317. We stand at the precipice of a moral and ethical crisis in our culture, and it basically distills to the fact, or to the reality of what will we do as a culture when we wake up and discover that twice as many of our children are hurting themselves so badly that they need access to general acute care. That happened before the pandemic. Between the years 2007 and 2017, we saw a 104% increase in admissions for self-injury to general acute care facilities. During that same period of time, we saw suicide leapfrog cancer and car wrecks as a cause of death. So I ask again, what will we do as a state, as a society, and as a culture when we see young people hurting themselves at the level we are seeing them hurt themselves at? One thing we will do is respond at scale in schools, in child-serving systems, and in community-based settings. But we must also respond when young people need us most, at their time of greatest need, when they appear before us in 5150 settings or in general acute care settings. AB 2317 closes a critical gap in our continuum of care, allowing us to meet young people at incredibly difficult moments and give them what they need. And what they need is not to be boarded in emergency departments and 5150 receiving centers. So it's with great pleasure I support AB 2317 and thank Assemblymember Ramos for his support.
Thank you so much. Well, thank you. Next, we have with us Jen Rexroad, Executive Director of the California Alliance of Caregivers.
Good morning. I'm Jen Rexroad with California Alliance of Caregivers. We represent the voice of relative and non-relative caregivers to promote the well-being of children in foster care. We represent kinship, foster, adoptive, and guardian families around the state who are really doing the work of caring for children who have experienced trauma and are in a place where they need to heal and thrive. And our members know more than anyone else what it is like to have children who are hurting and who've experienced trauma and aren't able to receive the services that they need to continue to grow and develop. It's heartbreaking as a parent if you have a child who needs critical mental health care services and there are none available for them, or they're waiting in emergency rooms for days and then released without receiving the care that they need. It would be similar to having your child in a very bad car accident and taking them to the emergency room where they need surgery and they need procedures done and having those services not available. What would you do? It's absolutely heartbreaking. And so we're very excited for this legislation that will bring services, much needed services, to children in crisis when they need them the most. Thank you.
Thank you so much. Well, thank you. Next, we have Louise Coons, CEO and President of the California Children's Hospital Association.
Hi, I'm Louise Coons, President and CEO of the California Children's Hospital Association. We represent the freestanding non-for-profit children's hospitals in the state of California. We're very pleased to be able to support AB 2317, which will help to expand appropriate treatment options for children experiencing a mental health crisis. And I want to thank Assemblymember Ramos for inviting me to speak today on this important legislation. As others have already indicated, California is in the midst of a growing mental health crisis among children and youth. Emergency departments in California's children's hospitals are witnessing this disturbing trend firsthand. For example, between 2019 and 2022, Chalk Children's in Orange County has seen a 52% increase in the number of children and adolescents seeking care in the hospital's emergency department for a mental health crisis. The length of time these children spend in the hospital's ED has also increased. From July 2019 to May 2020, the average time a child spent in the emergency department was about 7 hours if the child was discharged home, and 16 hours if the child was admitted to an inpatient psych unit. From July 2021 to May 2022, the average time increased to 12 hours and 24 hours, respectively. Rady Children's Hospital San Diego reports similarly concerning data. Over the last 3 years, the hospital experienced a 48% increase in the number of children coming to the emergency department experiencing a behavioral health crisis, and a patient's waiting time in the emergency department before being transferred for treatment increased by 97%. As these statistics suggest, there is a tremendous need for more residential placement options for children, places where children can receive quality and safe care that is less intensive than a hospital inpatient facility. These sorts of treatment options would also relieve long wait times in hospital emergency departments, which are stressful places for children and families in any event. Unfortunately, while private insurance will cover crisis residential treatment for children, Medi-Cal currently will not. Instead, children on Medi-Cal can bounce between 24-hour supervision in a locked inpatient unit to seeing a therapist on an outpatient basis once a week. Abrupt transitions in treatment modalities like these are frequently unsuccessful, and many children end up returning to a hospital emergency department due to a lack of appropriate alternatives. AB 2317 would address this problem and add an important tool to assist pediatric patients in crisis. We are pleased to be able to support this important measure, and we urge the legislature to approve AB 2317. Thank you.
Thank you so much. Thank you, Ms. Coons, for those statistics. Next, we have Phoebe Bell, President of the County Behavioral Health Directors Association and Behavioral Health Director of Nevada County.
Hi, thank you so much for having us here today, and I want to start by thanking you, Assemblymember Ramos, for sponsoring AB 2317. In Nevada County, we know firsthand the tragedy of an insufficient system of care for children and youth in crisis. We're a county of about 100,000 people, and like many of the rural northern counties, we have 0 inpatient beds in Nevada County. While we have a robust children's department and many amazing programs for young people through our partners in our community, not having this type of crisis intervention to offer to our community can be devastating. While our numbers are small, the journey is rough for children who experience crisis and who we do need to hospitalize. Picture being the parent of a 10-year-old who's lost control of himself, rageful, hurting his little sister, unable to regulate his emotions, screaming he wants to kill himself. Then picture trying to keep him calm and well during the 7 days of sitting in an emergency department that it takes to find a bed that will take him. Then picture packing that youngster into the back of an ambulance for a 3, 4, or 5-hour journey to the closest bed that would take him. This is the reality we currently face. There are not enough beds or levels of care for children and youth experiencing a psychiatric crisis in California, and this is especially true in our rural and northern communities. We believe strongly in providing excellent care to children, and we know that currently, with the resources available, we're not always able to do so. The children we serve have often experienced unimaginable trauma. Sending them through a crisis system that can add to that trauma is not acceptable. By adding this level of care to the crisis continuum, we'll be able to better serve the children of our community. We very much support this bill.
Thank you so much. Well, thank you so much for that. Also with us today is Brad Jensen from the San Bernardino County Director of Governmental and Legislative Affairs.
Good morning. Thank you so much for having me here, Assembly Member. San Bernardino County is delighted to support AB 2317, which is excellent state policy addressing a fundamental gap in care for mental health for our young people and youth. During the pandemic, we have seen a very sharp increase in the number of cases and also issues arriving from a variety of mental health issues for young people. We have 400 dedicated professionals in our behavioral health department, and county governments are really at the point of the spear to provide services and assistance for people who are struggling with a whole host of different issues. This is excellent policy that will create a new ability to have creative programs and also additional housing and bed capacity for residential treatment for people who are struggling with these type of issues. This will be a great benefit not only to the youth that are struggling with mental health, but also their families who really are unable to provide the type of treatment and care to address these challenges that they face. We are delighted to support this bill, and we hope that the state legislature will pass it, and then it'll be signed into law by Governor Newsom. Thank you.
Thank you so much. Well, thank you all for joining us today and for urging the passage of this bill. It's a bill that's much needed, but won't solve all the problems in the state of California. We have to get to a point to when we're talking about mental health services that it's one of the top 3 components that legislators and leaders in the state and the nation are talking about. When we talk about our youth, you've heard the statistics. They're in dire need of resources. AB 2317 starts to pave that way to bring those resources to the local counties and throughout the state of California. So when our youth are crying out, they get the resources they need in a timely manner. We have to make sure that we're continuing to work on these areas to bring resources to the youth of the state of California. Thank you for attending this press conference.